This is your song to keep in your heart, with the harmony of your smiles in the light and your fears in
Music
the
therapy
dark.
is a professional relationship between a client and a credentialed music therapist in which the music serves the client's needs and life goals.
Whoop! Whoop! Shake, 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 shake. Ow! Ow! Shake it up, shake it up. Oh, oh, oh. It's time to say hello.
Say hi.
Oh, it's time.
My name is Lori Kubicek, and I'm a music therapist that specializes in music therapy in medical settings. And I really feel that the importance of music therapy in medical settings for both adults and pediatrics is that music therapy helps patients access parts of them that are well, despite all of the many things that are challenging for them medically.
La 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 la.
Say la la la.
You can do that.
You do it. Say la. La. Da. 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 Now shake it up. Come on, let me hear it. Shake it up. Yeah, shake it up. Come on, let me hear it.
So for pediatric patients, it helps them to decrease their fear and anxiety, which is one of the primary barriers in their healing process. It helps them express themselves. It helps them connect with siblings or parents. Physically, it helps them, move their arms around or reclaim this arm that has been connected to this IV for so long. And it's just a place where they can experience joy for the purpose of healing.
Shake it up, shake it up. Oh, oh, oh. It's time to say hello.
Say hi.
Music therapy in medical settings is really most effective when it's done in a collaborative environment, when we speak with the other healthcare professionals about what their goals are, what are their psychosocial goals, what are their physical, emotional goals, and how can we really work on them through music. So when we have this kind of collaboration, music therapy is really at its best because we can meet a patient and see where they are in the moment, but also have all of their logistical medical information guiding all of the choices that we make in the moment about decreasing their fear, increasing their range of motion, or increasing their lung capacity through singing.
My name is Dr. Lisa Wong. I'm a pediatrician and a violinist and have a passion for music and medicine. Usually the first language that any baby hears, their mothers sing lullabies to them, and they're soothed by music. And as we grow up, there's music to celebrate a birth, to mourn a death, to celebrate a wedding. Music is really universal. Why not bring it more into the hospitals and into the healing settings, not just as isn't that nice, they have some music here, but really as an integral part of our healing process.
Rowboat motion, like you're in a rowboat. We're going to go forward and back. Forward and back. That's right. Forward and back. Forward and back. Forward and back. Forward. We were sailing along on Moonlight Bay. You can hear the voices.
My name is Diane Tao, and I'm a music therapist here at the Sherrill House, which is a skilled nursing facility, also called a nursing home. I've been here for almost 16 years, and it has been a joy to be able to share music with the residents here. We've found that music can reach people like no other stimuli can. Very fortunate to be able to use music as a medium to really engage people, particularly people who are in late stages of dementia. Music is one of the things that can really reach in and connect with a person when every other approach fails. Here at Sherrill House, I like to look at a person as really having needs in 5 different areas. Everyone has physical needs. They have mental needs, they have emotional needs, spiritual needs, and social needs. What we've seen here, particularly in end-of-life care, we've seen that music is something that can really help to transition a person from this life to whatever comes beyond.
It's a
Oh, wonderful.
Hello, I'm Dr. Kathleen Howland. I am a music therapist and a music therapy professor at Berklee College of Music. I also teach at Boston Conservatory of Music. I have a doctorate in music and cognition. I'm also a speech therapist and a clinical fellow in the Neurologic Music Therapy Institute. Music is diffusely activated throughout the brain. We become innately wired for it. It's preserved through most injuries and disease processes, which allows us access.
For the king.
When we look at how robust music is in the brain, I think it's important to think about when did that start. And 2 things come to my mind. Anthropologically, we have evidence that people were making music 35,000, 40,000 years ago. And that's just because we've found those flutes at this time. And so there was meaning for early hominids to be making music. The other piece that I am so moved by is the ability for fetuses to perceive music in the womb, and how they can demonstrate that they've heard that song or this song is novel, and they distinguish that in the womb. So music can create relationship between a mother and her fetus. Language, movement, although these are highly complex skills, music is the only one that's diffusely activated throughout the brain like that. Because of that, it really allows there to be a brain injury or a disease process somewhere down the line in one's life that still leaves areas accessible for music perception and production. And it's in those areas that a music therapist can work with that person and help them rehabilitate. Say in the case of Gabby Giffords, who's well known for her brain injury, help her relearn how to talk and to walk with music as an external prompter that is really allowing her brain to achieve more with the music than without. I think that the promise for neuroscience right now in studying the brain is showing more and more evidence as to why music education and thus music therapy matters greatly in the lives of all of us.
In terms of the future for music therapy in medical settings, the way I see it is that we've already come very far in music therapy becoming integrated in some medical settings. But it would be wonderful if across the board, wherever there were kids or adults that were in need of medical support for whatever reason, that they would have access to music therapy no matter where they were in their treatment process, no matter what hospital they were at in their treatment process, no matter if they were a NICU, baby, premature, or someone in intensive care, or a geriatric patient at end of life, that no matter where they are in their process, they could have music therapy, that it's supported by research, that it's evidence-based, and that it just becomes a normal part of quality patient care from beginning to end.
Oh la 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 la.